All right, so in this video, I want to talk about how broken free healthcare, specifically in this video, getting dental care for Medicaid. If you're in serious pain, your teeth are rotten, you got to get them pulled out. And it's part of my playlist here called The Broken Healthcare System in America, how broken and busted and what an abomination it is. And I'm basically just sharing real life moments as they happen and as they unfold. And I'm going to just kind of drop them into this playlist as I'm here dealing with my grandmother, who's 99 years old with dementia, and basically I've been taking care of for the last 6 months. So, little backstory. 2021, my grandmother, her dementia was already kind of kicked in. It was bad, but it wasn't like that bad yet. She actually had a full set of teeth. I remember she spent years saving up money to get herself like an actual full row of like porcelain teeth. Not dentures, but like they actually had teeth like put in. And she actually like had this nice, wonderful grill. Like her teeth were beautiful. But then all of a sudden, by 2021, her dementia really started to escalate. And, you know, when you are old, like my grandmother, she's almost 99 years old. And when you're like in your 90s and you have dementia, you forget to brush your teeth. And if you have a home attendant, like a home caregiver, they may try to brush your teeth, but people with dementia are stubborn, they're aggressive, they refuse care, like they will turn their head, like they won't let you brush their teeth. And I'm guessing, you know, probably she didn't brush her teeth, or like her gums got worse. Like as you get older, your gums get weaker. And I'm guessing her nice porcelain teeth start to fall out. And eventually by 2022, she lost all her teeth, unfortunately. It's very sad, but she lost all her teeth. And she has free Medicaid health care. You know, my grandmother, she's like a Section 8 kind of low-income person, and she has the free government health care. So you basically have to schedule a doctor's appointment to go get your tooth checked up at the dentist. You got to wait like a whole month for the appointment. And when she went there in 2022, you know, she had like her teeth were already kind of fallen out, cavities, like rotten stuff. And you would think they would just take them all out, but they didn't, because with the free health care, they have to first make sure the insurance is going to pay them. So they have to first like submit like a request to the healthcare insurance company to see how much teeth they can get approved to pull out. And pulling out teeth is honestly a pretty easy thing. It takes 2 seconds to pull out teeth. You get pliers to rip them out. Back in the day, barbers used to pull out teeth. You know, even in a lot of third world countries, they just pull out teeth with pliers. Like it's pretty quick. You get a drink a bottle of whiskey and, you know, pull it out. But here in America, they've made the entire healthcare system such a vague, you know, like virtuous, like unknown, you know, thing, and they try to make it more than it is. So they just make such a big deal out of pulling someone's goddamn rotten teeth out. So what I'm saying is, like in 2022, she went to the dentist and they only pulled out like 2 teeth out of all her teeth. Even though they're like rotten and all busted, they only pulled out a few. And then they basically would ask her to keep making a follow-up appointment because they would have to get approved for the next tooth or the next tooth. Or maybe the tooth is rotten, but it's not like rotten enough where they'd have to pull it out, where they can try to like now do a filling and justify it. So it's just they drag it out, and that's the worst part. So where all this is leading to is 2025 today. I'd say this last 6 months is when we've been taking care of her. This now, my grandmother has no teeth pretty much. And she just has like, you know, gums, and she had like a couple like roots, like rotten little stubs, like little nubs of teeth. She had like 2 rotten teeth over here, and like a few little pieces. So you understand how painful that is? Like somebody is old. They don't even know what's going on. They don't even know where they are. They don't even know who they are. Like imagine someone who's like mentally retarded. It's almost like the equivalent. Somebody doesn't even know they exist. You still got to treat them well. You still got to treat them with dignity. You can't just let them be in pain. It's like they don't know why they're in pain, but they're in pain. That's the same thing with my grandmother. So it's like, you know, she's like biting her teeth, but her teeth are going against her gum. So she's slicing open her gums with her teeth. Because imagine you only have 1 tooth. Like you have like 1 broken, jagged, rotten tooth, and you're biting, and it's going into your gums. So her gums are all getting swollen. And my grandmother was always in pain. And while we were with her, I called her Medicaid, I called her dentist, and this was like maybe in August is when we start to notice this. Because like originally when you see somebody with no teeth, you don't see anything. You have to like actually open their mouth and look in their mouth like with your finger. Nobody does this. Like you take your iPhone flashlight. Nobody does this. I mean, I didn't even think of it because you would think, oh, she got no teeth. She doesn't even have dentures. But yeah, there's little rotten stubs. So in August is when we kind of like heard her moaning and pain. She's always kind of picking at her mouth. And like the thing is, like some people with dementia, they're like, oh, like I'm in pain, but they don't say where. It's like, oh, my face, I don't know, and you don't know what it is. But in August is when, you know, we finally, like, she was complaining about like her mouth. Finally, she said the word mouth, so we figured, okay, let's take her to the dentist. So in August, I made an appointment, and then finally in October, you know, Medicaid, free healthcare. We get the appointment in October. We go to the dentist. They look at her teeth, and yes, she had like 2 rotten teeth down here. She had like 2 rotten teeth up here, and these aren't even teeth; they're like kind of broken stubs. And then she has like a whole row of like roots, rotten roots over here in her gums. They're like all rotten and swollen. And basically that day in October, they were only like approved to pull out like 2 of the like top row teeth, not the roots. They pulled out 2 of the actual teeth, but they left the other ones. So like, you would think it's common sense just to pull it all out, but no, it's like, hey, we only got approved to pull these. So they basically pulled these ones out. They said, okay, like, you know, let her recover and make another appointment. So I made another appointment, and now I got an appointment for like in December, like 2 months later. Keep in mind, this whole time my grandmother's in pain still, and somebody who's old, like 99 years old, it's pretty hard to make them to go to an appointment. It's pretty hard to get them to go out of the house. Like, you don't just go and jump in the Uber and walk down the stairs. Like, when you're old, it's pretty hard. Like, it is a day. It is a day of like getting them going, like getting them out of their bed. Like, it just, it's so hard to do anything with old people. Like, the stuff you take for granted is impossible with old people. So basically, we have to reschedule that December. And now basically we ended up with another appointment for February 17th, which is next week. And keep in mind right now, this last month, like January, my grandmother was in such pain. Like, her face, she's just constantly moaning in pain. I'm giving her ibuprofen, I'm giving her Tylenols. And you can't just keep popping these things. They're like 500 milligrams, like it'll kill your liver. But like, what choice do you have when someone's in so much pain? So like, I gave them to them. And then eventually, you know, her friend came. And like, her friend was sitting with her, and her friend actually went and opened up her mouth. And she saw her entire top row gums were swollen and like jagged and cut. Because that bottom tooth, that jagged tooth, keeps stabbing her gums. And we were like, holy shit, this is bad. Like, and I realized, like, I'm not going to wait. Like, this was what, like 2 weeks ago? I was like, yeah, I'm not going to wait 3 weeks, 4 weeks for this stupid dentist appointment just for them to like pull out 1 tooth. So I went and called all these local dentists. I went and called all these local places here in Brooklyn and Coney Island, saw a bunch of Medicaid offices. So they all told me, oh, you got to wait a month. You got to wait a month as a new patient. I even called the private dentists, the private places. And they were like, oh, we don't pull teeth. And I'm like, what do you mean you don't pull teeth? You're a fucking dentist. Like, that's what they teach you in dental school. I pull out a fucking tooth. Like, you know, like, if you just, honestly, if I had access to painkillers, I would just pull the shit out myself. I'll deadass pull that shit out myself. Like, I hate it. People try to make their profession more virtuous than it really is. Take a fucking plier and pull it out. I'll fucking do it. Give me the painkiller, but I don't have access to it. So basically, the next thing these private guys told me is either it would tell me it's like $1,000, like some crazy urgent price, or they're so busy, they also said, you know, new patients will see you next month. So that's what I'm getting here. Whether you go private or free healthcare, it's like for a simple ass procedure of pulling out some rotten teeth, like they just can't do it today. And then guess what? I called the hospital. I even called 911. I said, hey, my grandmother is like in horrible pain. We need to pull out these rotten teeth. Her gums are all swollen. They're getting cutted. I don't know if they're going to get infected. And the 911 operator was like, oh, well, you know, the ambulance is going to come, but, you know, they don't really pull teeth at the hospital. Like, you have to go to a dentist. And, you know, and I basically canceled the 911 call. And even the hospital doesn't do shit for you. And at that point, I was like, fuck, like, am I really going to wait all this time when my grandmother's, like, moaning in, like, horrible pain in her room? Because tooth pain is horrible. I don't know if you guys ever had a toothache. But, like, imagine your whole tooth is fucking rotten and your gums are all sliced because your broken tooth is ripping them open. That's horrible pain. So I felt bad for my grandmother. I felt really bad. And thankfully, her friend knew a dentist who, like, you know, works at a clinic but has their own side hustle. They're like a street dentist. They're a mobile dentist. And I guess this is what you call kind of like the black market of dentists. And thankfully, this exists. I'm so grateful this person exists because this is an example of what the healthcare system should be. This is what a healthcare system is. It's a service. And this woman was incredible. She's like an angel. I called her on the phone and she replied right away. She gave me a time, a price. She said, oh yeah, come today. It's $200 per tooth. And literally, like, we went to go see her the same exact day. I took my grandmother in the chair. I wheeled her over to her house. We went there. I drove there. We went up to her house at nighttime. Must have been like 9 p.m. We went to her home, in her kitchen. Like, we went into her kitchen. She had like a little side kitchen, little side office. She had like a little dental chair, her nice sterilized equipment. She was a professional. And we literally, she just went and checked her out. She's like, yeah, her gums are all swollen. Thankfully, it's not infected. And she's like, you know what? She has these 3 rotten roots. We got to pull these out. She had like 1 tooth over here. And she's like, you know what? I'm not going to pull them all out because it's kind of a shock if you pull out the top and bottom row. So I'm going to pull out the whole top row of these rotten roots and this jagged tooth. So she basically ripped all this stuff out, put it in the pain sterilizer thing. My grandmother didn't feel anything. She didn't even know what was going on. Like, didn't feel any pain. It was super professional. It was literally what the doctor and the dentist would have done at the office. And she did all this like in less than 10 minutes. Like, she just put the pain reliever thing and she just pulled the teeth out. And that was it. And there was like no blood, no nothing. Like, my grandmother didn't know what was happening, but now the pain was gone. Except she still had the bottom row. But now this top row was gone. And she did it in 2 seconds. And I paid her. And then she was even generous not to charge me $200 for every tooth. She's like, you know what? Because they're all roots, I'll give you, $200 for the whole thing. So she gave me a discount. I even tried to give her a tip, and she was like, no. She's like, just keep it. Like, I care about all people. So this, to me, was like the most purest thing of what healthcare should look like. This was real, genuine, free market capitalism. This was a professional service provider offering an urgent service right now in demand in a professional manner where it was done with sterile equipment and they're like no pain, done extremely quick. Everything was clean and professional. And she was even like talking to my grandmother and soothing her down so she was calm. Like, this was like the most professional experience I've ever seen. And she even like offered us tea and sat down with us. And she kind of like pat my grandma on her shoulder to make sure she was all good. And she said, goodbye, I'll see you guys again. Thank you, take care. Here's my number if you want to refer somebody. And damn, she was such a professional. That is what healthcare is. That's what it should be, but it's not, because in America, the healthcare system is such an abomination. It's been molested. It's been literally just like abused into this twisted bukkake of something that's no longer something feasible. It needs to die. Our current American healthcare system needs to implode because the government has been meddling with private business. All these cronies, all these insurance companies, they're all jacking each other off, and they're just screwing the taxpayer who's funding all this free healthcare. So the private care is paying for the free healthcare. I'll make a whole other video about this. I want to keep this video tight and related to dental, but it's this entire meddling of a simple thing that has now created this just monstrous, bloated abomination that only hurts people. Because like now people have to wait to get procedures. They have to pay insanely ridiculous prices. If they don't have insurance, they got to pay insane prices. If they got insurance, they got to pay stupid price for their insurance. Then they got like deductibles and like they got to pay a monthly premium and primary care, PCPs, appointments, waiting lists, all this bullshit. Like, you can't just go and pay for it. And then the worst part, I'm not going to go too off topic, but the worst part is even the doctor can't even like charge you a flat quote. They got to call the insurance company to get approved for their own procedure. They don't even know how much they're going to get paid in the end anyway. So I'll make a whole separate video about this. But to keep it tight, to keep it short, we got my grandma's thing resolved. And check this out. Today, we still had that last bottom tooth. So now her top row has been healing. She's feeling better. But this last week, her bottom row tooth has been bothering her. And now she had no teeth up here, but she got one tooth down here, and she keeps closing her tooth and is biting her gum. I see it's kind of cutting her. She's still in pain. So her dentist appointment is next week, and we could get it all done for free at Medicaid and, wait. But I was like, you know what? Let's just call the lady again, this wonderful woman. And she showed up today at 10 o'clock. What time is it? It's 10 o'clock. It's not. She showed up at 9 p.m. She did it like an hour ago. And she pulled out her tooth in 2 seconds, and now my grandmother is peacefully laying in her bed, not in pain, and she's just chilling. And hopefully now she is good. And I also want to mention to you guys as well why this is so serious. Why is this so important? You may think, oh, whatever, your tooth is rotten, big deal, who gives a shit? But when an old person, when they have no teeth and it's rotten, when an old person's mouth is in pain, they refuse to eat. When an old person refuses to eat, they start getting skinny. They become more prone to disease. Their immune system gets weaker. They get weaker, and now they start falling over. They stop drinking, and when they stop drinking, they become delirious. When they become delirious, they don't take their medication, and they die. And I actually have experienced this for the last 2 weeks dealing with my grandmother. Like a month ago, she was incredible. She was literally like sitting in the bed, watching TV, playing with my daughter, like eating and happy. Like she was talking. And this last month, ever since she's been dealing with this pain, she's been like delirious. Where now, like this is how costly and expensive it can get because she needs to eat, but she's refusing to eat. People with dementia, they just go into a trance where they will refuse to eat. They will refuse to drink. If you try to like feed them or force feed them, they'll spit all the food out. My grandmother literally spit out the vitamins. Like she refused to drink water. So like at that point, like I had to call in an IV therapist. And in one of my videos, I mentioned that I spent like $1,200 already on these IV therapists, like straight up cash. Like again, this is private. This is private urgent healthcare. But I paid this doctor for a premium. She showed up, did the IV, and my grandma got boosted and happy for a day. But you got to keep it lasts basically for like 3-4 days. And you got to keep doing it. So I basically been like doing IV therapy as a substitution. But I can't keep paying $300-$400 every single time. So like hopefully now my grandmother is good, and now that her teeth are out, hopefully the pain is gone. But this just shows you guys, like this episode specifically is this moment about dealing with free dental care, like free healthcare in America. Medicaid, it's bullshit. It's a lie. Like they don't give a shit about you. Like what's disgusting is people pay their taxes their entire life. Like people have a paycheck. Even if you're self-employed, you pay your Social Security, Medicaid, and they take it out of you like unwillingly. Like if you don't pay, you'll go to prison, they'll seize your assets. And like now when you're an old adult trying to get that healthcare, they tell you gotta wait a fucking month. They say, oh, we can only approve you for one tooth. Bitch, I've been paying you for 50 years. Like what the fuck? Like this is straight up fraud. This entire Medicaid, Social Security, I make a whole other video. This is one big house of cards, one big Ponzi scheme. It's a big bloated abomination, a big disgusting bukkake ready to pop. So I'm gonna end this video because it's getting too off topic and too vulgar. But this is my series exposing this abomination of our American healthcare system.